Hi, my name is Haley Kramer, and it's October 30th, and this is my final presentation for pathophysiology. And I'm going to be talking about cervical cancer. The definition of cervical cancer is an abnormal growth of cells in the cervix of a woman's reproductive area. These growths can be defined in a couple ways, as I'll explain throughout this presentation. 85% of cervical cancer comes from the transformation zone, which is the zone that is right between the ectocervix and the endocervix, which is deeper and more inside. 85% comes from epithelial cells that are thin, metaplastic in that area. 15% of cervical cancer comes from glandular epithelium that starts to grow in different ways and it doesn't look like the cells around it, can have bigger cytoplasms, things of that nature, and that glandular epithelium is normally seen in a different area, maybe a little lower than the transformational zone around the ectocervix. The classification of this disease, cervical cancer, is cancer. It's a malignant tumor, a malignant growth, a neoplasm, a conglomeration of cells that are radical and that grow in a way that the other cells around them do not. It has the ability to metastasize and to affect other organs around it. So the classification of cervical cancer is, you could call it a women's or female reproductive disease, or you could just call it a type of cancer. The etiology of cervical cancer is very often related to HPV, or human papillomavirus, which affects the high majority of sexually active adults. Lots of sexually active adults do have HPV. It doesn't always lead to cervical cancer. It just is very often the cause of it. And if it's not HPV, then another way that people could start to have cervical cancer would be if they were very immunocompromised people. That could be a different way, but really most of the time it is the HPV presence that does develop into the kinds of cancer. Syndrome. It doesn't really fall into a syndrome. Cervical cancer can produce symptoms that may seem to be other kinds of syndromes, like abnormal bleeding or abnormal vaginal feelings or dryness. Maybe those could be related to menopause, but really it's not good to classify cervical cancer within a syndrome, because it really is a disease that kind of stands out on its own. A lot of its symptoms or a lot of its causes and the way that it grows, it can't just be grouped into a different kind of syndrome than just reproductive dysplasias. Manifestations of cervical cancer. A lot of times in the early stages, there are no symptoms. A lot of women are asymptomatic in the preliminary or early stages of cervical cancer. And as it progresses, the symptoms become more and more apparent. Early symptoms may be, if they exist, abnormal bleeding, abnormal discharge that's malodorous, and sometimes also pain, especially after intercourse, or that just comes at random times. Abnormal bleeding could be heavier bleeding or bleeding that's not at the time of normal menstruation. Advanced symptoms of cervical cancer can be a little bit different. Uremia, blood in the urine, deep vein thrombosis, as is DVTs. Clots are common with lots of types of cancers. Lots of bleeding, like even rectal bleeding, that could happen, or just heavy, inexplainable to the woman who wouldn't know. Bleeding, excessive vaginal bleeding as well could be in the more advanced stages. Different testing for cervical cancer. So the preliminary test is a pap smear, and that's the one that women are recommended to get every year no matter what, just to test for the status and the types and the classification of the cells in the cervix and in that transformational zone. A lot of times an abnormal pap smear, though, doesn't mean cervical cancer. An abnormal pap smear just means that the cells in that area may be in a transformational time. There could be some different kinds of things to watch out for, but a lot of times it could be HPV, but a lot of times things like that will either progress and get worse, or they'll just go away with the immune system of the body. So a pap smear is not completely indicative, but it is often that first step. Colposcopy is a test that's a lot more indicative of cervical cancer, and that's done by taking a biopsy or a smear of the cervical tissue, and then defining it in a way that can be defined by a cervical intraepithelial neoplasm, or CIN. And there's CIN 1, 2, and 3, and depending on how far it's progressed, it can be classified in 1, 2, or 3. Only less than 20% of the time does it ever progress from 2 to 3, but 2 and 3 are those types of classifications of the types of cells that will lead to the diagnosis of what kind of stage the person is in who is experiencing these issues. So a CIN of 2 or 3 may be more indicative of stage 2A, 2B kind of cancer, where it's gone deeper, it's greater than 4 or 5 millimeters in length, sometimes can be seen to the naked eye, these kinds of things. So that's the test, and a colposcopy or a biopsy. Also an HPV test is a good test to have as well, just to rule out any differential diagnosis. Leading into differential diagnosis, a very possible one is an endometrial cancer, also called uterine cancer. So it's the cancer of the inner lining of the uterus, and sometimes this can spread to the cervix. So that could be a differential diagnosis because there can be cancer present in the cervix, but if it originates from the uterus or from that endometrial lining, then it would be defined as uterine cancer and be completely different. Another differential diagnosis could be cervicitis, or inflammation, or polyps, which are a little bit more normal if they're benign. And then finally, complications of cervical cancer. If it's early stage and it never really progressed to advanced cervical cancer, early stage could just be an early menopause because of the radiation that the woman has gone through. Also could be vaginal narrowing, and that is additionally due to the radiation that the woman would have gone through. A lot of times the radiation is just directed specifically at the area, and it could be directed at that area, or it could be a little bit further and therefore shrink the cervical tumor and also eliminate any metastases around the area. But again, that's depending on the stage of the cancer. But vaginal narrowing from radiation is a complication of it that she'll deal with for life. A more severe complication that would come from advanced cervical cancer would be kidney failure, and this is because during the progression of cervical cancer, if it as it progresses, it'll go first to the lower 2/3 of the vagina, and then it'll go into the back like pelvic wall, and if this progresses and it gets larger, it can press upon the ureters, and then if it presses upon the ureters, that can create a blockage, and that can fill the ureters with urine. If it fills the ureters with urine, that can lead up to the kidneys, and that can lead to some pretty detrimental effects on the kidneys, and that could be something that if the ureters were constantly exposed to urine all the time, there was consistently a blockage there, even if the cervical cancer has been dealt with, the kidney repercussions could be felt for life. So these are this is the presentation on cervical cancer. I hope you enjoyed it, and thank you very much.